Another question we got was why, when we talk about herd immunity, why aren't we using natural immunity? Why don't we just say that, well, if you got it, you're good. And so if I've had COVID, I shouldn't need to get a vaccine. Well, there's a problem with herd immunity that what we know with the most accuracy is if you had a symptomatic case of COVID-19, you probably have sufficient native antibody-mediated immunity for about 3 months. And past 3 months, it is absolutely not uniform. People who got less sick than others still had better antibodies later on. We know this locally, and when I say locally, I mean Carroll, West Central Iowa, state of Iowa. We've had a lot of people over the previous year after they got COVID go to attempt to donate plasma. Well, when convalescent plasma was one of the main treatments we had, a lot of people who had COVID tried to donate and were told after just 3 months they didn't have high enough titers to donate. So the problem with using just natural immunity or I got infected so I'm good enough is that there is very little uniformity or rhyme or reason on how long you'll actually be immune for. And that's very different with the vaccines. While we're going to learn about 12-month immunity later on, we know 3 and 6 month is very uniform, and it's a lot more predictable as far as the efficacy. Anybody else have anything to add on that?
I would just say that the immunity that the vaccine affords is the T-cell long-term immunity. And there's a big difference between that and the short-term IgG immunity that you get from the natural infection. So in this case, the getting the vaccine is better for long-term, no question. And it's because of how it affects the immune system. So to get true herd immunity, we have to have people vaccinated.
Absolutely. And Sarah and Nikki, we've seen this locally where a non-vaccinated person who had a previous case of COVID-19 recovered, tested negative, and then caught it again. I mean, we've seen this locally.
Absolutely. We have seen it a handful of times or more that they've said, oh, I had it back in December. I went to Mexico, had a test to come back. It was negative. And a month later, they're positive again, and they're symptomatic.
So one of the reasons for getting us out of this via vaccine is it is a much more effective and straightforward way of, as Dr. Evans mentioned, getting rid of the fuel for the forest fire.